While working in a nursing home, I experienced the use of chemical restraints among elders every day. The use of antipsychotics can be beneficial, but it can also be considered a chemical restraint. I have worked in nursing homes and home health as a CNA for 9 years. Today, I noticed in my audience analysts that this information will benefit many of you, for you will experience it with your elders or loved ones in a nursing home among the future. Today, I am going to provide you information on chemical restraints, who they can affect, how they are used or why they are used, and how to consider them misused. Chemical restraints are the use of medical drugs to penalize a person for their actions by the restricting of one's abilities that are not required for their diagnosis. In the article, Legal Aspects of Chemical Restraints, Julie mentions that every drug prescribed for medical usage can have a chemical harmful reaction with over-the-counter drugs. The use of chemical restraints can affect a person's self-determination. The overuse of antipsychotics can cause a person not to speak or think clearly. It can cause them to be withdrawn, sedated. It can impair their memory, and it also can give them risk of falls. In 1987, OBRA, the Nursing Home Bill of Rights, banned the use of chemical restraints. Residents have the right to be free from physical and chemical restraints if it's not required for their diagnosis. The statute further states that chemical restraints can only be imposed to ensure the physical safety of the residents or other residents in a nursing home, according to Julie. Now that you know a little about chemical restraints, I want to inform you to who they may affect. Chemical restraints affect many residents with dementia, Alzheimer's, behavior problems, and mental disabilities. Jan Goodwin on AARP Bulletin shares that 1 out of 5 patients in the nation's 15,500 nursing homes are given antipsychotics. 25% of them are residents, 40% of them have dementia. Lipson says that if a person is in a nursing home for more than 5 years, they're more than likely on a chemical restraint. 70% of them are antipsychotics. The article, Legal Aspects of Chemical Restraints, Julie mentions residents were taking antipsychotic drugs on a regular long-term basis had harmful effects. She also states that numerous drugs with drug combination places a person over the age of 65 in harm. In March, Health and Human Services charged 1/3 of Medicare patients in a nursing home are on chemical restraints. She states that the chemical restraints are not intended for elders who are fragile with Alzheimer's and dementia. Now that you know who chemical restraints can affect, I want to inform you on why they are used. Many nursing homes use chemical restraints for Alzheimer's and dementia. They use them for related psychosis. She uses them for control behavior issues, for punishment towards the residents, for staff convenience, and for substitute for a good care. When properly used, chemical restraints can be important for a resident. When the drug can help the resident reach their highest well-being. Chemical restraints benefit the ones that suffer depression, suicidal thoughts, and can harm others that refuse to eat. Stated in Elder's Advisor, in emergency, chemical restraints can be used. Chemical restraints can be used when other methods for tragedies and for treatment of medical conditions fail. Also, chemical restraints can be used when behavior jeopardizes the residents, other residents, and staff members. Behavior problems among residents and its explanation nursing homes use today for antipsychotic drugs to National Consumer Associates. Pharmaceutical companies market their products as an easy way to control these behaviors. Stephen Lipson, in the book of Reward of Restraint, Free Environment, mentioned that one study found that 50% of the residents have no documentation that justifies their use of antipsychotics. Antipsychotics are used to treat behaviors, again, anxiety, sleeping problems, and depression. Some nursing homes use chemical restraints unlawfully when they are not educated on antipsychotics. Use drugs to reduce annoyance among others. People use them to make the resident care easier on staff, and easier intervention for individuals. Now that you know why chemical restraints are used, it is easy to pinpoint how they are misused. The use of chemical restraints in nursing homes are among many, but the misuse is far more common in elders today. 2% reports reveal that the practice is still continuing among nursing homes. Yet these preventable practice causes harm among residents, according to Stephen Lipson. Drugs may cause some residents to become agitated, confused, drowsiness, decline in eating, walking, dressing, using their walkers, their wheelchairs, and even the bathroom. Chemical restraints can influence a resident's gait and balance, causing a person to fall. It can cause partial or complete loss of muscle movement, and it also can cause your blood pressure to drop, resulting in the risk of a stroke or heart attack. It's considered misused when there's no informed consent or physician order. In Julie's article, residents or their POA must give consent before given drugs for any purpose. Considered misused if there is no physician order that specifies the duration or circumstances for given medications. Misused for discipline or convenience, or if it's not in a resident's comprehensive care plan. National Consumer considers it misuse for residents who slump in chairs, cannot get in bed, do not attend activities, or do not talk to loved ones anymore. According to the AARP, misuse of drugs can also cause death. Chemical restraints is used properly and can be beneficial for your loved ones, but always be open to the misuse of an antipsychotic. Today, I provide you information on chemical restraints, who it can affect, why they are used, and when to consider them misused. If you and your family ever run into a situation that a loved one has to be on an antipsychotic, drugs for medical symptoms, I hope you consider the effects it can have on them and pick the intervention best for that individual. As I stated in my intro, many of you have a loved one who will live in a nursing home. And I hope you consider the knowledge on chemical restraints and the beneficial for their freedom and safety.
Very good. Yeah, that's why my grandmother told us we put on so many values.